Parkinson's disease affects the entire person, not just their ability to move, but also their ability to think, their ability to adjust to the diagnosis. It can affect their vision, it can affect their eating habits. So Parkinson's affects the entire individual, and because of that, you need a team approach that involves clinicians and specialists from a number of disciplines to holistically address the needs of the person with Parkinson's disease. If you're interested in starting a treatment plan for your Parkinson's disease, the first place to start would be with your doctor, to talk either with your primary care doctor or with your neurologist if you have one. Medications for Parkinson's disease target dopamine in a number of different ways. Dopamine is a neurochemical that is produced in the brain that stimulates a number of different brain functions, including movement, emotion, reward, and many other emotional states. The first main way is by preventing the degradation or decay of dopamine in the brain. The second major way is by increasing the amount of dopamine that's in the brain. And the third is by helping other medications that you may be prescribed to maintain optimal levels of dopamine in the brain. Anticholinergic medications reduce the amount of another neurochemical in the body called acetylcholine. And by reducing acetylcholine, you can have some improved motor functioning in Parkinson's disease. These medications can increase the benefit that you may get from medications that target dopamine. And your doctor may prescribe other medications depending upon your unique situation. Deep brain stimulation is a surgical technique where a stimulator is implanted into the body so that certain areas of the brain that are affected by Parkinson's can be stimulated. You can think of this almost like a brain pacemaker. And DBS has shown benefit for some individuals in the control of tremor and other Parkinson's disease symptoms. Some of the non-medication therapies that we often recommend for people with Parkinson's disease include physical therapy, which can actually help you to move better, occupational therapy, which can help you to perform activities of daily living better. Speech therapy can be helpful in order to improve your voice quality and your ability to project your voice when you're speaking. And psychotherapy can be very helpful for you, as well as your caregivers and loved ones, to adjust psychologically to having Parkinson's disease and learn ways to cope emotionally. Some of the lifestyle changes that you can consider if you have Parkinson's disease is to establish a heart-healthy and brain-healthy diet, to exercise regularly. Exercise is very important because it gets the body moving. And we know that Parkinson's disease is improved when people get their bodies moving. Social and cognitive engagement is also very important. To stay active in activities that get you talking to other people, that get you spending time with other people, and activities that you enjoy. But you should always talk with your doctor first before starting any kind of treatment plan or any kind of therapy to make sure that it's safe and right for you.